Committee on Health and Human Services meeting to order. And I am the chair, Monique Baker McCormick, the newly appointed chair. And we will go ahead with roll call.
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki.
Here.
Commissioner Daub.
Here.
Commissioner Anderson.
Here.
Commissioner Colleen.
Here.
Chair Baker McCormick.
Here.
You have a quorum present.
Thank you. Next item, please.
B, approval of the January 26, 2021 meeting minutes.
Colleen moves approval, Madam Chair.
Thank you. It's been moved by Commissioner Colleen and supported by
Marecki.
Marecki.
Yep.
Thank you. We're approving the minutes, and is there any discussion? So we have a motion and it's been supported. All those in favor?
Aye.
Aye.
Any opposed? Motion passed. Next item, please.
C, old business. There is none.
Actually, I do want to discuss an item we talked about in our minutes, which was creating a report or a one-pager that would go out to the commissioners that addresses the COVID. Do we have anyone to talk to that? Is Carol on or Dr. Hamami?
Madam Chair, were they asked to be at the meeting?
Yes, they're always asked to be at the meeting, as far as I know.
Madam Chair.
The clerk should have requested their attendance, yes.
Okay. I'm sorry, Madam Chair, this is Nellie Lee, Director of Policy and Compliance for HHVS. I will reach out to Carol Osterberry and Dr. Hamami right now and see if they are able to connect. I understand that they were going to be on, perhaps there was some other matter to attend to, but I will reach out to them and have them sign on.
If you can, and then we'll
Absolutely.
come back to that item. Thank you, Ms. Lee.
You're welcome, thank you.
We will move to the next item, please.
Item 2, communication from the Department of Health, Veterans, and Community Wellness forwarding the report on the amount of medical insurance reimbursements collected for fiscal year 2018 through 2019.
All right. Is there anyone to speak to this item? Is Mr. Caparou available or anyone to speak to this item? Okay, is there something going on today where nobody's here? What?
Madam Chair, this is Nellie Lee again. I will reach out to Mr. Caparou as well.
Okay. Is it something going on today that no one is here or that we don't know about?
Not that I know of. If there is an event going on, I was not invited, so I will reach out to them.
Okay. Because they're usually right here on point. So
yeah.
Just wondering.
I will assure you that we did receive your agenda and the right people were alerted. So I will remind them.
All right.
Thank you.
Madam Chair, Colleen?
Yes.
On this
Yes,
item,
sir.
Madam Chair, I believe this report also came to another committee, and I forget what it was. last week. There was a time, if any inmate leaves the jail to get medical at a hospital system, Medicaid would not cover the cost of those bills if they were not in the jail, if they were being treated in a hospital system. And that situation changed, and now we're getting more reimbursement instead of the county paying those medical bills. Medicaid is now picking up a lot of those bills. So this is what the report is here for, is to look at how much the situation is improving with reimbursement on people that we have in the county jail that have to get medical treatment, like at the DMC mostly.
Okay.
And I don't know what you want to do with this report. Do you want to wait for Mr. Caparu?
Yes, we'll just
Okay.
go move to the next item.
Okay.
And
I was
then
going
come
to move
back
to
around.
receive. I was going to move to receive and file, but we'll hold on to that.
Okay, great. Madam Clerk, we'll go ahead to the next item, please.
Item 3, communication from Health, Human, and Veteran Services Department, Clinical Services Division, forwarding notification of an emergency procurement report for Amendment 2 to a contract with Memorial Healthcare.
Thank you. Is there anyone
Yes.
from Health and Human Services here to discuss this item?
Hi, good afternoon. I'm here. It's Jennifer Caruso. How are you?
Hi, how are you?
Good. It's been so long. I'm trying to refresh my memory here. This was submitted back in November. We needed additional funding for newly booked inmate COVID testing, for diagnostic and antibody COVID testing for inmates booked into the Wayne County jails. We asked for $250,000 for newly booked inmate testing and an additional $220,000 to increase capacity for laboratory testing for Memorial Healthcare. So for a total of $470,000 for Memorial Healthcare for newly booked inmate testing, COVID testing.
All right, and is there a report as to how many tests that have been administered or?
Sure.
Mm-hmm.
So as of yesterday, we have tested a total of 7,903. So 7,903 inmates with this project.
Okay, and it does this also, or I guess you just said inmates, but are they also testing any employees or just is strictly inmates?
This would be just the inmates with this project.
Okay. And of those 7,933, do we have or know how many was positive?
Yes.
Okay.
I have a total of 105 positive PCRs, which is the diagnostic test.
So of that 7,000, it was 105 that were positive.
That's correct.
Okay, and you're still isolating those that have COVID?
Absolutely.
Okay. All right. Any questions from the members?
I also have an update. I want to speak also on the capacity for the $220,000. I received an update on the capacity for that from Memorial Healthcare today as well. So
Okay.
they're validating the test kits for that, for the same day results. They're validating the positive and the negative COVID test today, this week actually, and they hope to have same day testing available very soon So that's an update on that front as well.
Okay. And you know what? Speaking of the same day testing, and I don't know if you can even talk to this, but just wondering, is that something that would be available at home, like a same day testing kit of any kind? Are you aware of that?
No, not through this project. It would be
Okay.
on site.
All right. Because I know some of our senior complexes now are able to take the tests on site, and then they put them in this a kit, and then they send them over. So I wasn't really sure if you had information on that.
No.
All right, well, thank you for that information. Any other commissioners have any questions?
Yeah, Colleen, Madam Chair.
Go right ahead, Commissioner Colleen.
Thank you. And I wanted to actually ask commission staff. This says that this is amendment number 2 to this contract. So when, to commission staff then, when did this contract actually begin?
Yes, this is Chris Albrecht, Commission Policy Staff, Policy Analyst. Allow me a moment here to pull up my background or backup documentation, please. Thank you.
Yeah. Okay.
And then I will have that answer to your question.
Yeah, because the follow-up question to that is going to be, well, I got different numbers here. It says amendment number 2 increases the total contract not to exceed from 750 to $1,000,002, but it also says not to exceed $470,000. So I'm not, I got to get those numbers figured out. And then also has these services delivered. This was requested November 30th. Have any services under this amendment been delivered before the amendment and the additional funds were approved? So those are my 2 questions.
Well, to answer the latter question, this is an emergency procurement report for an amendment number 2 to a contract. So commission approval was not required. This item is here for receive and file, and we did an analysis on this item since it was COVID related and since we've been scrutinizing the emergency procurement process a little more since it's been used more lately. I do have an answer to your original question too, Commissioner Colleen.
Thank you.
The term of the contract began June 8th, 2020, and it was set to go through December 30th, 2020. Modification number 1 was from August 1st, 2020, and the term end date remained December 30th, 2020. And now with amendment number 2, its start date was October 30th, 2020, and the contract was still or did end on December 30th, 2020.
Well, and I'm glad staff is reviewing this because I think we have to go back. There's just been a blizzard of emergency procurements as it relates to COVID, which is understandable. But for the public accountability and keeping track of all of that, a question I will have for staff, since you're looking at this for down the road, we still have to conform to the procurement ordinance, and we can't be allowing people to spend money on contracts before it's approved by the commission. So I would have that concern as staff looks at this. I would have that concern about this one as well. I don't think we can answer it today, but I think
Yes, Commissioner Colleen, I've requested a report of the emergency procurement spending for COVID.
And this goes into the hopper then, Commissioner, Madam Chair, to make sure that expenditures are happening in and services are in conformance with our procurement ordinance. So that's it. Thank you, Madam Chair. This is a receive and file, I believe.
Yes, it is.
So I'll move to receive and file and forward to the full commission.
Is there support?
I'll support Dobb.
Thank you. It's been moved and supported. Any other further discussion? All those in favor?
Aye.
Aye.
Any opposed? Motion pass. Next item, please.
Would you like to move to the addenda or do you want to go back to
Addenda. Mhm.
Item 4? Detroit Wayne Integrated Health Network presentation on the 2019 to 2020 annual report by Willie Brooks, President and CEO, and Eric Doe, Deputy Chief Executive Officer and Chief Operating Officer.
Well, welcome, Mr. Brooks and Mr. Doe. Thank you for coming to provide a report. So you can go right ahead.
Thank you so much for having us. I don't know how much time we have. I want to be mindful of your time. I don't want everybody to run off on me.
You can go right ahead. If it gets too long, I'll let you know.
Very good. Well, I just want to acknowledge some of the people that are here. As you mentioned, Ms. Brooke Blackwell, our Chief of Staff, is on this call. Eric Doa, my Deputy Chief Operating Officer, is on the call. And also Mr. Commissioner Bernard Parker, our Board Chair, is also on the call. I believe those are all the names that I see. And of course, one of our board members, Commissioner Colleen, who's also, of course, a commissioner, he is also on this call. You all have received the report. What I would like to do is just go over some of the highlights of the report. And then, allow my colleagues, if they would like to have any comments also, and then any questions. I'll just go over maybe 5-10 minutes and then just move forward. Many of you know Detroit Wayne Integrated Health Network is the major supplier of behavioral health substance use for Wayne County. We roughly serve 75,000 people in Wayne County, which is roughly 25% of the total Michigan Medicaid population. We are the fourth such largest institute in the nation. So our behavioral health agency ranks 4th in the nation. We handle, as I mentioned, behavioral health, substance use, and we try to focus on what we call holistic care and the 5 basics of holistic care, which is social care, economic care, behavior, physical, and spiritual well-being. So we try to focus on all 5 of those things. We help people with a variety of things as it relates to fulfilling those goals. That includes assisting with housing, jobs, life support systems, all types of things. We are out there and willing to help. Some of the things that have occurred recently, now that we're in this pandemic, since of March of 2020, like many other people, we also have been operating remotely for the most part. The building is still open. We try to keep it clean and sanitized. We are an essential worker. Therefore, we never stopped during the pandemic. We have people who we serve 24/7. Therefore, we cannot actually stop processing. But we did put forth a lot of effort to make sure that our staff is as safe as possible. We have routine testing, and we also make sure that our building is not met at its maximum capacity. We have things spaced out. We have thermometer cameras in our Milwaukee building, so when you actually walk in, they can identify who you are, take your temperature, and if your temperature is correct and they identify you, then the doors will unlock. So we're going through all that process to keep our staffs safe. One of the things that we try to do also at Detroit Wayne is to improve technology. And that is something that I've done throughout my career. In the behavioral health side, I spent over 20 years in the physical health side and over 12 years in the behavioral health side. And one of the things that I noticed is that our technology on the behavioral health was not up to par as it relates to some of the health plans. So we put a lot of effort in improving our technology. One of the things that we recently did at the beginning of the year was remove all of our desktops, put in laptops, and allowed our staff to have mobile access. This proved to be very timely, especially with the pandemic. We were easily able to put our staff in a off-site working environment and remain a high productivity. We're improving on our off-site working productivity by looking at measures to actually measure the productivity of our staff while they're off-site and giving them supplies necessary so that some of our jobs will actually remain off-site. We found that to be very productive and it saves money. We provided COVID testing to our AFC homes and group homes. We're a major distributor of personal protection equipment, PPE, to many of our providers. A lot of those supplies are provided by the Michigan Department of Health and Human Services, and then some we actually purchased ourselves. So we are a constant supplier of PPE to our network. We're also working currently with the city of Detroit as far as getting vaccines out to essential health workers and some of our most vulnerable citizens that are living in residential group homes, adult foster care, and supportive housing. We're in the process of doing that as I speak. We have several Detroit Wayne substance use disorder providers open up COVID recovery homes to better assist throughout this pandemic. As you know, this pandemic has been a major part of our lives. We recognize that our lives will not be the same. That there's some things that will change permanently. So we're making some changes and trying to make sure that we keep people as safe as possible. We're putting out newsletters, trying to educate people on some of the things that are going on with COVID-19, trying to educate the public on now the use of virtual and different conferences out there. So many people have not really had the opportunity to experience the internet and virtual technology as we were forced into it. As a matter of fact, when we had the issues with the school system, nearly 30% of the population in some of the Detroit areas did not even have internet access. So now we work with those different homes. We work with our elderly to try to get them up to date to ensure that they can also have access to our technology. We're also in a pilot program with Detroit Police Department. You might hear more of that from some of the other people on this call. We're very excited about that as far as working with them. And we also have offering a free mental health assessment tool, which is called Mindwise. We're very proud of that. You can actually see that on our website, dwihn.org, that you can actually go through this process. It's free to the public. And then we are in the process of opening up a technologically advanced access call center. We're very optimistic that this call center will help alleviate some of our inpatient hospital visits and some of the run-ins that we have with the people that we serve and the police department. It will allow us to better have people moved into proper care versus jails and inpatient. Inpatient care is not the best place to treat people. It's very costly, and the service is not as beneficial as actual home care. We also know that over 80% of the people who are incarcerated have some type of either substance use or behavioral health diagnosis. Therefore, we really want to put a lot of emphasis in our jail services. We also know that trauma is high in our school system. So we have a lot of different programs out there working with our youth, trying to prevent them from having and developing more severe behavioral health issues. So we're trying to catch people at an early age. As a matter of fact, when I visited prisons, when I asked some of the prisoners, what can we do to prevent people from coming here? And one of the main things that they say is try to get people at an early age. If we can connect with people early, we believe that we can try to shorten the possibility of them having severe behavioral health issues. Now that's a high overview of some of the things that we're doing. We're doing a lot, very, very excited about some of the things that we're doing. Even in the midst of this pandemic, we are taking a lot of these challenges and creating opportunities within that amount. So with that being said, I'm going to ask if our board chair, Commissioner Parker, if he would like to say anything, and then afterwards I would ask Brooke or Eric if they would like to speak.
Okay, thank you, Mr. Brooks, and hello, Wayne County Commissioners and staff related to Wayne County. I don't come back very often to make any type of reports, and this is the very first time I'm doing it from my kitchen. So hopefully this is the new age that we live in right now, and we all have to make adjustments. I just want to briefly speak about two of the things that Mr. Brooks had already talked about, but I just want to highlight them a little bit. One is that we are in the process of developing a crisis center on Woodward Avenue in Detroit, and that's going to be able to accommodate people that are maybe would have gone to the hospital, and the hospital costs are much higher and they don't get the same type of care. But the crisis center will be where either the police or one of our providers could bring someone there to get care. Professional will be there to work with them and to try to find them placement on a permanent basis. So that's something that we've been trying to do for a number of years now. So we're now in the process of renovating the building over on Woodward Avenue, and hopefully in 2022 that it'll be open. So that'll be something that we look forward to being able to have. The second thing, as Mr. Brooks talked about, we did back in June of 2020, the board passed a resolution saying that we need to do something with the whole Black Lives Matter movement taking place, and the whole idea of trying to redirect some of the funding that came to be known as defunding the police, but that never was the intent. It was the intent of trying to redirect some of the funds in order to respond more to some of the needs of the community. So we, as a behavioral health specialist here, we decided to work with, we asked the administration to work with Detroit Police Department to see if there's some partnership that we could develop. And from that, we were able to develop a program that we announced in December and is now in action in a couple of the precincts downtown and 9th precinct, where we actually have a behavioral health specialist that will go with the police officer when there's a call comes in. We have in Detroit 911 calls, they have over 20 calls a day of people that have some mental health challenges, and their only recourse before was to send out the police. And sometimes that escalated the situation, particularly a person is having some mental health challenges. Now we'll be able to have a person ride with them, go there and intervene, and hopefully be able to diffuse the situation. Obviously, in any violent situation, they would not be the first one to respond. The police would. But in other circumstances, many times, relatives and others just call the 911 because they don't know who else to call to respond to somebody in their family that's having some challenges. So we hope that's really going to be a model, and our intent is to duplicate this throughout Wayne County and other police departments. Along with that response team, there is something that we became aware of, what they call frequent callers, people that call 911 continuously. They estimate they get like 16,000 calls of people just calling 911 without really an emergency, just wanting to talk to someone. And they had one particular person that called 4,000 times year before in 2019. And so our person will begin to call them up and see what kind of assistance they need, because most people that are doing that have some type of need to be either talk to somebody or some other type of emotional needs. So we were trying to intervene and try to get them some help so they won't be tying up the lines. And the last thing is the homeless. There's a real effort now to try to not just pick up a homeless person off the street and take them to jail, but rather for someone to go out there, intervene, again, trying to put them into some permanent placement or at least get them some help. So that's the demonstration project that we're doing right now in the city of Detroit. The last thing I just want to mention is that, as Mr. Brooks said, everybody indicates that we need to reach people at a younger age, those are having some emotional needs, or even just for preventive purposes, and to talk with them. We're in 71 schools now throughout Wayne County, and they are there to assist in any type of counseling or things that might be necessary, but also to do preventive type of work, having workshops, educating children on various aspects of mental health needs, and maybe they can observe something in one of their friends that they didn't know what to do before, but now they would have some recourse if that person is starting to have some challenges, both mentally or substance abuse. So we hope to be able to get into as many schools as possible. We continue to use our funds, but we're looking for additional funds so we can really expand that program inside the schools. So those are some of the things that in particular I just wanted to highlight from Mr. Brooks' report.
To the chair, Madam Chair, I'm certainly not going to take more of the commissioner's time here. Just wanted to touch upon just a few things as it relates to, we find ourselves, of course, in this Black History Month. And it is true that life's most persistent and urgent question is to be asked is, what are you doing for others? And at Detroit Wayne, I mean, that is indeed one of the hallmarks of the work that we do. Mr. Brooks alluded to the fact that we provide services to over 75,000 folks. 15,000 of those folks alone are children. More than 5,000 are seniors, 65 or older. That's a big deal to us, providing services to children, especially where we are in this COVID environment here. You're talking about, school-age kids, well over 290,000 in Wayne County alone that may need our services. Right now, we are providing services to about 90,000 of those kids. We want to expand that even more so to make ourselves more visible. We did a study not too long ago and determined that depression, anxiety, bullying, dating violence, suicide were some of those risk factors that were identified. And so because of that, what we have put together is a school initiative plan working with 11 of our community service providers within the schools to really tackle those risk factors, because it is that important to us that we are visible within the community. Oftentimes, folks make the statement that we're the best kept secret. No, you don't want to be the best kept secret. We don't want to be a secret. We want the community to know that we are out here, and we are out here to provide those services whenever. When COVID first, became so apparent, starting in that early March, one of the things that we did was to establish a hotline called Reach Us Detroit. That hotline was there and has been there to allow folks to really reach out for those, challenging times and moments that they were having. We had clinicians that were staffing and reacting to those calls. So we are not only this data-driven organization, but we are also very reactive to what is going on within the community. We work with well over 300 providers within the network, providing services for children, adults. So those SUD services, services to pregnant women, the list continues. And those are just some of the things that we continue to do here at Detroit Wayne. On the provider side, telehealth has become a huge part of how business is conducted now. So we have broadened that even more so within the network, certainly adhering to HIPAA and all of the other rules and regulations, having the necessary platforms in which those services can continue. But we've also recognize that because providers were not having those face-to-face contact in those high percentages like they were used to prior to COVID, we had to provide some additional funding out here to those providers as well. We made sure that that was done for our skill building providers. The same was done for our autism providers. The same has been done and will be done for some of our SUD providers. Our residential services, well over 200 residential providers. Again, when COVID, struck, making sure that we had transitional homes that could account for those persons who were testing positive and in those different settings where there were, 2, 6 or more persons not wanting the infection to spread, we made those transitional homes apparent there. So those are the things that we continue to do at Detroit Wayne, making PPE available to our provider network, something that we continue to do. Our direct care workers, those are the folks who provide services, and are not paid this incredible sum of money, but we've also been able, to work with the department to make sure that that $2 increase was something that was given to those workers so that they can continue to do the work that they do. And so, Commissioner, Madam Chair, thank you for giving us this time. I'm sure that my colleague, Ms. Brooke Blackwell, has a few things, but we just didn't want to take so much of your time, but wanted you all to know that we are not that secret. We are that organization that is here to help for members within our community.
Well, thank you all for that comprehensive report. I think it is important for us to understand what you do. In fact, I don't know if you're aware that we started and I sponsored a Wayne County Commission Youth Council last year. And it's interesting that mental health was the main issue for them and their concern. And so they're going to be working on a resolution to talk to some of the issues that they go through as young people. And so I would really want to get your direct contact information. If you can email me your information so that we can follow up with you and talk through what you're doing. I know you said you're in the schools, but what does that look like? What programs do you have? You also said you work with, Detroit police. So what does that look like? So if you can send me, and then I can forward it to the other commissioners, but just the details of those programs. And in particular, again, I'm very interested in the youth component and what you're doing in the schools. I also had a question in reference to the number of increased, I would assume that it's increasing cases of mental health issues. Would you say, Mr. Brooks, that the increase is tremendous, or it's around the same? What would you say about that?
First, I would like to say Brooke Blackwell gave her contact information, so you can get all of our information, all of our contacts from her. So that's your one source to connect to all of us. And then two,
From who? I'm sorry, you said?
Brooke Blackwell.
I can chime in there real fast.
Okay.
Madam Chair, Brooke Blackwell, I'm the Chief of Staff here at Detroit Wayne.
Okay.
One of the organizations that we have partnered with was reachusdetroit.org. It is a joint partnership that we at Detroit Wayne did with the Skillman Foundation, United Way, and they offered a free text line and counseling line, offering free, and it would partner in very well with what you're talking about with your youth count, with the Wayne County Youth Council, but they offer 12 free counseling sessions to anyone over the age of 14.
Oh, okay.
So I'll be happy to forward some additional information about that,
Please do.
and putting you in contact with some of our clinical folks that work with that line. We have billboards going on throughout the county offering up information about this free text line, since we know that our young people are glued to their phones, but offering this information that's out there about the text line, and connecting these individuals with services. And I mean, since we know that not everybody's made out of money, but sometimes our young people are afraid to speak up or speak out to the parents and the adults in their lives. But if they know that there is this free app that's out there, or a free chat line where they can reach out to, anything that we can put in their hands to offer some unique options for them to reach out for assistance, it would definitely be of assistance to them.
That would be
Forward that
great.
along.
And I don't know if you have a one pager or flyer
Yes.
or anything. Okay, that would be
Absolutely.
great. That would be great.
Absolutely.
And
In
then
addition to that, I'm sorry, in addition to that, there is also a group called Youth United that is throughout the county, that is comprised of young people that go throughout our schools as well, to kind of connect young persons with behavioral health care services. So that is some
Great.
additional resources that I can make available to you.
Thank you. That'll be very helpful.
So to answer your question, as it relates to how our volume had picked up, initially when the pandemic occurred, we had this phenomenon in which trauma was going up as it relates to domestic violence, mothers dealing with their children on a full-time basis, the stress of not having employment. So trauma itself went up. Mental health needs went up. However, our cases went down because people were afraid to get help because of COVID-19. So now we have more people who are coming out. We recognize that the trauma issues are still high, and we see a very high uptick in telehealth services. Now that people are beginning to utilize that, we probably had a 20% increase in output just with that telehealth service alone. So we had a big drop, even though trauma was going up, and now we're getting prepared for a higher usage. Also during that time, we tried to stabilize our provider network by offering different incentives out there, giving some reimbursements at previous levels, looking at providers who might have lost money because they could not have performed the services during that time, and then trying to reconcile some of their losses, because we have to make sure that we maintain a strong provider network, because we do see in the future that the need will be great.
Thank you. Thank you. Any commissioners have any questions? I see Commissioner Anderson. Go right ahead.
Thank you. I just wanted to ask, it's probably hopefully a question that'll help others too. Do you have a intake number or a central intake if someone needs assistance, they have a child or someone that they are that needs some mental health services, and they're reaching out and they just don't know where to turn to? I mean, is there an intake number that you could share with the commission or the committee members, so we would be able to refer them to? Because I know it sounds like you're not doing, because of COVID, you're not doing direct face-to-face, and if, you know, but there are, of course, emergencies that still occur. And I'm just wondering, I had a lady that has a I believe he's 11 years old now, adopted child, and he has he's getting more severe, and she just doesn't know where to turn to.
I will say yes, we are still doing face-to-face, even though some of that is slowed down because of COVID, but we also are doing telehealth to make up for that. Our 1-800 number, and I know Brooke has already put that in the chat, is 1-800-241-4639. 4949. So that is in your chat to everyone, but that number can be used. Some of our services we have to do face-to-face. We're dealing with people in group homes and different other homes on a 24/7 basis. So we have to interact.
Right.
So
Okay.
And Commissioner, that's some of the reasons why we've brought in that service in-house. So as far as the intake is concerned, you can still call our number and we're the ones answering those calls, directing folks to those providers who will then provide the services. So that is still going on now, along with face-to-face, just that it is limited, that's all.
Okay. Yeah, I understand the difficulties you're dealing with, and we're all having to do things differently, and I certainly can appreciate that. But I do appreciate the information I see now in the chat, the number, and I jotted it down. I'll keep it handy and pass that along to this lady. Thank you.
So one thing, Commissioner Anderson, just to follow up, again, Brooke Blackwell, Chief of Staff,
Yes,
I will
Brooke.
send along a brochure that we have. It's an electronic brochure if you guys want to just keep handy, just how to get access to mental health care services. That 800 number, it's the same number that we've used for, I mean, the 8 years that I've been around here. But it's just that one single access number, so someone can say, oh, well, the numbers change, or I don't know who to call, but it's one number for any behavioral health care services in Wayne County, so that someone can say, well, I don't know what number to call, or how do I get into services if I'm in Woodhaven or Livonia or Detroit or any place in Wayne County. You call that number, they'll ask, you know, what city do you live in? So that way you can find a provider that meets your needs in your neighborhood, that is close to you, and that can get you into services as quickly as possible.
So that is a good point of entry for any service.
It's the only point of entry, so that way there's no confusion.
Very good. Thank you. Thank you very much.
Thank you, Commissioner Colleen. Commissioner Anderson. Commissioner Colleen, you can go right ahead.
Thank you, Madam Chair. Two things here. One, I want to pass along probably to you, Ms. Blackwell. I recently became aware of a nonprofit in town that's producing PPE, and they're hiring returned citizens in order to produce that. I'll put it in the chat, but all in caps, it's ISAIC, ISAIC. And if you, Google that or whatever, the nonprofit in Detroit will come up that's producing the face masks, producing them locally. A question I have for Mr. Brooks. We have adults in homes all over Wayne County that are being taken care of by direct care workers. And we already mentioned the $2 raise coming from the state. What do we know about direct care workers? The report right now is that there's a lot of teachers that are retiring early. How is the population of direct care workers to make sure that we have enough to take care of the folks that live in these homes?
As you know, the direct care workers have always been a struggle, mainly because the requirements are so high and the reimbursement rate does not match the difficulty of the job. So many people have other options that they can use at a lower pay. Now, you add COVID-19 in the mix, which now people have to further subject themselves to the potential of COVID-19. And you add to the fact that unemployment benefits were so high that it was beneficial for many people to not work than it was to work. Many of our providers are having a difficult time filling those positions because of those dynamics. So it was already difficult before the pandemic. It is becoming more difficult during the pandemic. And it is a constant struggle that we have. The added wages help, but it's still not quite enough. So that is a constant struggle that our providers have.
Are we to the point with this that we're not able to take care of folks, that we have to decrease the number of folks we care for because there's simply not enough direct care workers to support that?
Well, what happens is you have the dynamic in which you will get people, but you're not getting the top choice individuals. So you're not getting a lot of people with a lot of experience, with a lot of background, because they have a few more options. So even though they're able to fill some of these positions at a lower rate, the high level employees that they were able to keep in the past is becoming more difficult to obtain.
Yeah, I suppose. Thank you for that, Mr. Brooks. But you're right, it has been a struggle. It is getting worse here in COVID. And I think I want my colleagues to be aware of that. And also, at some point there needs to be some help from the state of Michigan to professionalize these jobs a little bit more. One of the problems that we do run into, Mr. Brooks, is as you describe the folks that we are attracting to these jobs, if something untoward happens in one of our homes, a direct care worker slaps one of our people, something like that, it's been known to happen. They get fired from that job, but they can move right over to another home. That there's no tracking of these individuals, there's no background checks that go on. And so there's a lot of ways that we are making this vulnerable population even more vulnerable. And this whole area of direct care workers really needs some serious attention, starting right with the governor in Lansing. So thank you for the report, Mr. Brooks, and thank you, Madam Chair.
Thank you, Commissioner Killeen. Are there any other questions from members? I see Mr. Blackman on the line. I actually was just talking to staff about having you all come to our next meeting. So if you could reach out to us, Black Family Development, I would like you all to provide a report. You there, Mr. Blackman? Or is he not any longer?
Yes, I'm here.
Oh,
Thank
good,
you, Commissioner.
good.
Thank
Good.
you.
Okay, so yes, if you can, maybe not the following meeting, but the one in March. Okay,
All right.
thank you. All right, Madam Clerk. Thank you, Mr. Brooks and your team for that report. And we will move to the next item.
Thank you.
Mhm.
Item 5, communication from Brooke Blackwell, Chief of Staff, Detroit Wayne Integrated Health Network, forwarding the DWIN 2019 to 2020 annual report.
This is just the receive and file item, Commissioner. It's the report that they just discussed.
Okay, great. Do I have a motion to receive and file?
So moved, Marecki.
And actually, we're receiving and filing both reports, right?
There's only one.
One, okay, I see the last one, yes. It's been supported. It's been moved by Marecki. Is there support?
Yes, support Dobb.
And it's been supported by Dobb. All those in favor?
Aye.
Aye.
Any opposed? And any abstentions? Motion pass. So we'll move back to the receive and file item number 2. And I think Colleen made a motion for that, but we'll see if Mr. Caparu or anyone is available to speak to that yet. Ms. Lee?
Hi, this is Nellie Lee, Commissioner Baker McCormick. Mr. Kepru is unavailable to attend the meeting today. He had another commitment, but I did speak with him. And also during offline, I did speak with Mary Carr, who stated that she would speak to Mr. Abbo. Essentially, this report covers the medical reimbursements for fiscal year 18 and 19, which was also contained in the same report that was reviewed by HHS committee 2 weeks ago at your last meeting. Because of the way that I think they crossed in being submitted, the newer report, which covers 17 for 3 fiscal years, was actually submitted later and heard earlier. So this report covers 17 and 18 and was essentially the same information that was reviewed at the last HHS committee meeting.
Right. The question I had is because this says for 18, 19, and I wasn't sure as to why we're looking at this report at this time for 18, 19.
Oh,
Madam Chair, this is Mark Abbo. I can give you the answer to that question.
Okay.
At one time during the budget hearings, we used to just get a one-year report. And we thought that it's better when we have comparative information. That way we can look at trends. So last year we had asked them to use a 2-year report, so they had to just add the new information to the prior report. And now we've gone to 3 years, so it gives us a further trend. And we're going to keep it at a 3-year trend, so we can see, you know, rather than looking at information in a vacuum, it gives us an opportunity to look at any trends that may be developing and the type of information that we get.
Okay. And so if that's the case, then why wouldn't we have looked at this when it came up at the last committee meeting?
I can't answer that, Madam Chair.
Yeah, that was what was confusing, because I knew we just looked at an item for this same matter.
Yeah,
but then this one was 18, 19. So, okay. All right. So
my apologies for the confusion,
okay.
Commission Chair. I'm sorry.
No problem.
Committee Chair.
So Commissioner Colleen moved to receive and file. Do we have support on this?
Support.
And it's been supported by Commissioner Dobb. All those
comment
in favor?
before we vote, Madam Chair?
Oh, sure. Go right ahead.
The report that we have here, if I'm reading this properly, shows that we actually decreased the amount of reimbursement we got from 1918 in or 2018 in 2019. So I think that needs, I don't know if it's Mr. Abbo or Mr. Kepru, but you know, the budget instruction just says, give us the totals. And that's exactly what we get. But I think what we need is more of an explanation. Why is this going up? Why is this going down? Right? So we can actually learn something from the report. But as I read this report, the amount of reimbursement fell between 18 and 19. And I'd be curious to know why that is. We should be going up and getting more reimbursement than we did in previous years. So I'm not going to hold up the vote on receive and file, but I think that's a question that we should ask someone before the committee answer at some point. Thank you, Madam Chair.
Thank you, Commissioner Colleen. So it's been moved and supported. All those in favor?
Aye.
Aye.
Any opposed? Any abstentions? Motion passed. And next item, please.
Are we getting an update from Dr. Hamami?
Hi, this is Nellie Lee from HHVS again. I believe that Carol Osterberry is on the line.
Yes, I am here.
All right. Thank you, Ms. Osterberry. We just wanted an update on the current COVID situation, and Also, we had requested a one-pager to go out to the commission so we could keep abreast of what's going on a weekly basis. And just wanted to see if where you are on that.
Yes, yes, Commission Chair, thank you so much. I apologize. We had a little, just a scheduling glitch there. But anyways, I'm here. And yes, actually, I have our weekly report is really very good. Our total number of new cases during the reporting period, which is January 31st through February 6th, total new cases was only 758. And this is the first weekly reporting period since October 11th through the 17th, when we have had less than 1,000 cases for that weekly reporting period.
Yay.
Yeah.
That's
Total
great.
deaths during that same period, 37. But yes, our case numbers are going down. Our top 5 communities for this reporting period: Canton Township, Livonia, Dearborn, Melvindale, and Redford Township, and Westland. And as I said, when our epidemiologist actually plots this out on like an epi curve, a linear curve, yes, our 14-day look back is a confirmed negative trend, downward trend. And I can say that the average number of cases for the reporting period has again gone down from 170 cases per day to 129 per day. That's the average number of cases in that 2-week period. So again, it's that downward trend that we are, sustained downward trend. And let me see here. Now, when I had said earlier about those daily counts in the top 5, we are still seeing Dearborn, Livonia, Canton Township, Dearborn Heights, and Redford Township. Again, like I say, those communities, every week we're seeing them maybe move up to number 1, to number 2, number 3, those same communities are staying in our top 5 consistently. Very good news also, the positivity rate. So for Wayne County, for this reporting period, is down to 5%. Last week it was 6.2%. So last week 6.2, this reporting period 5%, and actually before that the reporting period from January 17th to January 23rd it was 7.8. So now we have three consecutive weeks of the Wayne County positivity rate again going down. And the state of Michigan for this reporting period, 4.2% is the positivity rate. And the same thing with the state. It's gone from 6.3 to 5.1 to 4.2. So we are, seeing our same trend as the state on that positivity rate. Now we'll talk about testing and daily testing capacity. And daily tests per million, a 7-day average, 2,963 daily tests per million population. So that's very good. We're still doing a lot of testing. And we have all of our testing sites. We track them all individually, and then they are all of those locations are right on the Wayne County website, easily to, for people to find. They are no appointment. They do collect insurance information, but if someone does not have insurance, they are not turned away. We have not had any more pop-up testing events. Our last event was in Harper Woods the first weekend in December. I will tell you, I was out there, and by that weekend, being outside trying to do these testing events, the weather has really, winter makes those outdoor events. We were cold out there that weekend. So we have not had any more pop-up testing events, but a big part of that is because we have really transitioned over to so many with these outside vendors of the testing that we are having done through them. So we don't need to have those popping up out in the middle of a parking lot event. Let me see, and I apologize, I'm going through. And another metric that we always track are the percentages of hospital beds, and this is kind of small, that's why I'm looking a little closer. We're down to 65% for hospital inpatient bed occupancy. Again, a few weeks ago when we look at this every week, it was right at about that 78, 80%. So that's very good. Again, in line with those downward trends that we're seeing for the number of cases. Then I can tell you for vaccines. So vaccines administered, I have two numbers here. For the Moderna vaccine, almost 10,000, 9,971. And then for the Pfizer vaccine, 18,202. So between those two, we have administered almost 28,000, virtually 28,000 vaccines. So then our current vaccination sites, again, because of that weather, we had our drive-through site here at the Health Administration Building, and Saturday was our last day to actually use that as a drive-through. The snow, the cold, it has just really gotten physically just unbearable for us to be in the garage. We have a few last second dose individuals who need their second dose for vaccines here. So we are having them actually come into the clinic, and we have a separate vaccine area for them, and then a waiting area for those individuals after the 15 minutes after they've received their vaccine here. And again, as we said, we are weaning away from this location. It's just, I myself was out in the garage, some of those days, and we have heaters. It's been very cold. And we have our two new vaccine locations, Schoolcraft College out on Haggerty Road in Livonia. And then we have Wayne County Community College in Taylor on North Line Road. And at those locations, we have the only day when we actually run both those two locations on the same day is Saturday. We're finding Saturday is a very popular day for groups to be able to come in and send their employees. And we have been focusing last week and this week, really the primary focus has been all of our educators. And when I say that, I mean anyone who works in a school. It's not just teachers is my point here. Anyone who works within a school, and we have been focusing on those. We have over 20,000 that we need to vaccinate last week and then this week, and we are going to be virtually completed with all of those vaccines by the end of Saturday this week. We'll probably again have a few, almost like a makeup day or a day for substitutes or, but we are virtually going to be completed with our schools. That's for the first dose when I say completed. And so then, yes, our critical health care, first dose are completed, second dose still in progress. Long-term care staff and residents, we did have to go out to some of those long-term care facilities. CVS and Walgreens did the majority, but we did go to a few. First dose completed, second dose, we are still in the progress of finishing up some of those. Necessary healthcare, those are the ones, dentists, ophthalmologists, physical therapists, just all that group that we've been talking about a lot here, where they were not really accounted for in the state plan. So all of us local health departments have been vaccinating them. And again, we are getting pretty darn close to those first dose. And many of them actually have been coming through here for their second dose. So we're finishing up that group too. And then we've got those frontline essential workers. That's public safety, law enforcement, education, and correctional staff. Our public safety and law enforcement, we again are right at the end of that group. That public safety and law enforcement also includes the Wayne County Sheriff's deputies. We have been doing vaccine clinics right there at Division I, Division III jail, so that then they can, they don't have to leave work. They can come down the hall, get their vaccine. We also have been out to the juvenile detention facility I think today even they were out there for second doses over at Juvenile Detention Facility and Division 1. So again, it's, I'm very pleased that this is a very comprehensive plan. We aren't doing all just at one location, not all drive-through, not all, where we go out and actually are vaccinating, at different sites. So, that really is making this a comprehensive plan that's meeting the needs of, all the different groups. And with that, any questions?
Thank you. I had a couple questions. I actually asked this about testing for COVID. Do you know when or if we will have home testing kits? Any possibility of that?
That's a good question. I have, in reading and heard about the rapid home testing kits. I don't know what a timeline is for any of those kits to be, actually available, to the, I just don't know. I haven't, heard anything on my state or national calls that we're on, but you're right. That is something it feels like that is on the horizon.
Okay. Also, mobile vaccinations. Have we looked at that at all?
Yes, and we are working with contractual arrangement with an outside vendor who has a mobile unit. The details of all of that are not finalized, but yes, you're exactly right. That is an aspect of our program that we are looking at and working on finalizing up terms of a contract.
Okay. And the number of vaccinations that we have received from the state, is it a rolling number, or are we getting, I know Dr. Hamami said that they were going to just give us a certain amount every week. So what does that number look like now?
Yeah. Right. And yes, you're exactly right. We are getting a set allocation for our first doses and now our second doses. And last week we received, I think it was around 8,300. And then this week we only received about 7,400. So, the state tells us, yes, you're going to receive the same amount. And then we start planning, and then, we're always ready to adjust things. And we find this out on Friday, hopefully early morning, as to exactly how many we got. But you are exactly correct. It is a set allocation now. The state has a set allocation for local health departments and for any of the like healthcare systems, healthcare systems. And included in that is also allocation for the pharmacies, CVS, Rite Aid, and there is a pharmacy chain that is up in the Upper Peninsula that is now receiving vaccines. And the pharmacy program, the vaccine is all dedicated or allocated for 65 and plus.
So the actual number of vaccines went down
A little bit.
Okay. So, okay. Thank you. And any other, I see Commissioner Marecki.
Yes, thank you, Madam Chair. Carol, I was reading that they're recommending that if someone had COVID, that maybe they should only be getting one shot. Are we doing that, or is anything going on with that?
Anything that our medical director, Dr. Carl Schmidt, has, advised is no. You get 2 vaccines. If it is, if let's put it this way, if that is the for the manufacturer of the vaccine. Now I'm hearing, Johnson is coming out supposedly real soon, and that is a 1-dose vaccine. So then you would only get 1 dose of that. You see what I'm saying? But like what we have currently, Pfizer and Moderna are 2 doses.
No matter what.
Yes.
Okay. All right. Thank you. Yeah, I think that's it. Thanks. Thanks for the update.
Thank you, Commissioner Marecki. Commissioner Anderson?
Yes, thank you. I wanted to, Carol, if I could just ask you a couple of questions. Are we strictly using Moderna right now, or are we doing a mixture still?
We are still doing Pfizer and Moderna. I can tell you though, where we are strictly only at Wayne County Community College, we are only doing Pfizer. And at Schoolcraft Community College, we are only doing Moderna. We do
Okay.
not have a clinic where have both manufacturers. That's where we are separating them out.
Okay, so we're getting enough supply of Pfizer now to give first vaccinations with Pfizer now again?
Oh, yes, yes.
Okay, because I know at one time we were only getting enough they were trying to reserve that, make sure that all the second vaccinations were, they were being preserved for that.
Right.
And you said Wayne County has done about 28,000 vaccines so far. And how does that compare to what the hospital systems, are we getting reports from them as to how many they're vaccinating? Do we have to get a greater sense of across the county what's happening?
Right. That's a very good question. We do meet with the hospital systems every week or every other week, kind of depending on what's going on with the vaccine. They do report out to us how many doses they are administering, on their average number per day. I do not, but we do not get reports as far as like a weekly report from Beaumont, Henry Ford. We don't get, what their total runs are, but I will say, we do get the report out as to how they are vaccinating, on their averages per day.
Okay. The reason I ask that is I think a lot of people become very discouraged when they're trying to get an appointment. Right. And if they only hear the numbers that Wayne County Health System itself is doing, they just are very discouraged, I guess is the best way to say it. And if we have those numbers to also say, okay, that is only Wayne County, but if we have those other numbers reported in and can at least put that in a report, then I think they feel, I would think they would feel better. And did you say CVS and Walgreens are now getting allocations from the state?
Wait 1 second here.
Just curious, because I thought it was only this week or next week they were going to start vaccinations.
Okay, so based on and I'm sorry, I wanted to pull my notes here. So from my regional meeting on vaccines, this is what I was informed. Rite Aid, Meyer, so I apologize. Rite Aid, Meyer, and then Cardinal Pharmacy Chain, like say, I think that was the one that's up in the UP. Okay. So Rite Aid, Meyer, and Cardinal are the ones that are getting doses for the 65 plus. CVS and Walgreens are still getting doses so that they can finish up those skilled nursing and long-term care facilities. They are still getting, but so their doses are not like the Rite Aid, Meyer, and Cardinal Pharmacy Chain for where, the public can then, I think you have to like submit a request and then, they contact you when you actually have been scheduled for your appointment.
Okay. And so CVS and Walgreens are going to be doing the straight 65 plus.
Yeah, please. I don't know that for fact.
Okay.
I can tell you right now what they are doing are still going out to the
nursing.
The skilled nursing. Yes. Right. Yes. That's what I know.
Can you put as much of that into that one pager that's been requested so we can provide updates to the folks in our district? And I'm sure everyone, just like myself, is getting a ton of messages, whether it be text messages, emails. Just you guys are getting, I know, much more than we are, but we would like to make sure we have some good information to pass along.
Right.
If you could do that and make sure that's in that report, that weekly report would be beneficial for us to pass it along. Do you know when, at what point restaurant employees will be on a list, when they would be eligible to get that? Because they have now, with the restaurants opening and that, we need, I think, to do what we can to make sure that folks going in are safe.
Yes, and that's a very good question. And as we finish up the schools, the daycares, we certainly have those restaurant and grocery, store workers on our radar. They are next. So we will be working to, get them scheduled. Can I say it's going to be next? I'm not really sure, but they certainly are next up.
Okay, you're thinking maybe within the next couple of weeks?
Depends
on how long it takes to get.
It so much. Yeah. I wish I could, vaccinate them.
All right. Okay. And I think that's all I have right now. Thank you. Thanks for all you guys are doing.
Thank you, Commissioner Anderson. And Commissioner Colleen, go right ahead.
Thank you, Madam Chair. And thanks for being here, Ms. Osterberry. I'm going to hit similar themes that we've been talking about here, and that is reporting and communicating with the public. And I've had a couple of calls into Mr. Noling. I don't think we need a one-pager. I think we need 4 or 5 one-pagers. And to do it by grouping, this is who is administering the vaccine, right? The story on CVS has been out there a while. I went up to my CVS the other day for prescriptions, and they have signs up saying, no, we don't have vaccine. So it's not clear to the public. Now, they may be going around and doing this at senior facilities, but people are under the impression that they can go to their CVS and get it. We have to clear some of this stuff up for that. And when you talk about mobile vaccinations, that's not the hospital systems. That is our group of people that have been assigned to us in the county. And so that sounds different to different people too. Oh, well, they're going to, and you do have up on the website now, almost 30,000 vaccines have come to Wayne County. There is another number that's floating around out there in cyberspace that says about 120,000. And I think that has to do with what the hospital systems are getting. And I think we have to be a lot more clear to people about that as well. And as you know, we're all getting it, you're getting it. How come Wayne County isn't signing people up? Oakland County's doing it, Macomb County's doing it. There's still some, but they're in the city of Detroit, but they're a Trojan horse for the hospital systems, where they're having another way to call the county because it sounds like the county's doing something then, and all they're doing is plugging people into the hospital. So there needs to be a lot more clarity, just like with the schools. Our process here was that we contacted RISA. RISA surveyed the various school districts as well as all of the charter schools in the county and reported a number to us. Livonia needs so many, Allen Park needs so many. But there's still a lot of confusion around that. And I think we need on our website or otherwise to have a list. These are all the schools in Wayne County. These are the ones that have been done. These are the ones that are going to be done next week. This is the kind of information that people aren't seeing. And it's certainly not us, only us. It's confusing. So I want to help the public as much as I can. I have a friend, a constituent, guy I go to church with, who's been number 2 in the Macomb County Health Department for a number of years. And I called him up to say, hey, we're hearing this stuff that Macomb County's doing it so better, Oakland County's doing it so better. He's like, yeah, we hear the same thing. Wayne County's doing it better, Oakland County's doing it better. People in Macomb County actually tracked down his home phone number and were calling him at home. How come I can't get a vaccine? The usual stuff that's going on out there. And he said any comparison between counties is really unfair because everybody was left to their own devices and how to do that, right? The feds said, hey, states, you go get the vaccine. We got nothing to do with it. The feds didn't want to distribute. We're getting some of that now. And then, of course, the state gets it, and they don't have their system up and running. So they kind of say to the county, okay, here it comes. You guys kind of figure out. So everybody's been building a system as we've been trying to distribute. And I don't think we should be shy in saying to the public that is indeed the case. And to really give people more realistic data. as to what's going on out there. And I think we need to have the hospital systems numbers up on our website too. We've gotten 29,000. Of course, the hospital systems, they're going to have their own thing about what they want to release and what they don't. But this is public money. It's all got to be out there. How many went to the hospital system? How many did each hospital system get? How many have they administered? And because people are still confused on a whole lot of these issues, and even the matter of sites, Ms. Osterberry. I invited someone to this meeting who lives in Harper Woods, who's on city council out there. By this time, she had to go to another meeting, but she was like, oh, we heard that Wayne County Community College out there on 8 Mile in Harper Woods was going to be vaccinating people. Well, no, right? And so before this gets out there that Wayne County is going to be vaccinating people, we have to have dates. When is this going to happen? Because people just, and you know how it is, people hear this stuff on the news. Oh, WCCCD is going to, yeah, and then and then you're off to the races and people think it's happening. And then when they call and it's not happening, they're like, well, what is wrong with Wayne County, right? And you get into all of that again. So I think the communication here, about a month ago when Dr. Hamami was here, he talked about, how many people in the 65 and over, and how many people in each one of these categories. I think we need to be very specific, and this would be just one sheet. Who does the county vaccinate and who does the hospital systems vaccinate? And how many people is that, right? I don't know what we got for an over 65 population in out Wayne County, because you have the other problem of the city of Detroit taking care of Detroit people, and that causes confusion too. But I don't know, we got what, a couple 300,000 plus 65 in the county. How many vaccines are we getting? How long is this going to take us? And if the hospital systems have them, how many vaccines are they getting? And how many are they administering? And then specific to us, and of course these change. And I'm going to call Mr. Noli and get a hold of him after this meeting too. I got some, I used to teach high school, getting basic information out to people in a digestible form. And I do have to say, you're on the county website and you hit the frequently asked questions button, you get 10, 12 pages. Ain't nobody going to read 10, 12 pages. And it's not that the information is bad, but it's the format. And I can see that we would take those FAQs and break them down into 3 or 4 major categories and give people digestible pieces to work on. So, I'm just, and we're all getting this, right? And I get another call today, and then you look on Facebook and you got citizens out there trying to tell you what Myers is or is not doing. There's just a lot of, so authoritative, straightforward is probably one of the best things we can do right now, and show from week to week, this is what we are assigned. And people seem to think that these phases 1A, 1B, and 1C are inviolable, that there's some, no, there's been some political decisions being made as to who gets the vaccine now and who gets moved up a little bit in these phases. There are some of those decisions being made. And so to keep people up on this is what the county's responsible for, these people. And this is how many there are in the county. And this is how many vaccines we're getting. The hospitals are responsible for these people. And this is how many vaccines they're getting. And this is how many people that they eventually have to get to. And so, I think phase 1A, 1B, 1C just make people's eyes glaze over in thinking about that. So all of that to say,
oh, go ahead. Mm-hmm.
Well, no, all of that to say, and this is where I'm getting, I see you, Madam Chair, and I hear you. The reporting of this is so essential. And this is one of the things with clear reporting out there, it will take the temperature down a little bit out there. Where the temperature really goes up is when people think, I heard one thing or I saw one thing, and then when I called somebody, that wasn't it. And then they're mad at everybody, and that's the noise. And then we get the phone calls, we get the emails, and you get the phone calls and you get the emails. So I want to work with folks on this. We need to correct this a little bit. I go on the Oakland and the Macomb website, not necessarily any better there. So Madam Chair, I'll leave it at that, but better reporting, and I'll work with whoever I need to work with to get better information out to the public.
All right,
Clear.
thank you. And I agree, we do need a simpler way of, channeling the information and getting the information out there. I see Commissioner Marecki, you had another question?
Yes, just a real quick question. And Carol, I have not gotten a complaint at all about the weight of the vaccine. I mean, the physical weight while you're waiting in line. But someone mentioned to me that sometimes people are staying in line for 3 hours. Is that true?
I have not heard. Saturday I myself was over at Wayne County Community College, and we had, again, Saturday was for educators. The line was, it was moving steady. I was hearing a couple hours there. So,
okay.
We are working, again, even standing out in the cold, I fully understand it, but I haven't heard that long, no.
No, and I have not heard one complaint, and believe me, there's a complaint about anything. So I have not heard that. Someone just mentioned it to me. And, my parents live in Oakland County. My mom has received her shot, both shots. My dad is on the Oakland County list, the U of M list, the Beaumont list, the Meyer list. He's 89 and he still hasn't gotten the first shot. So there's just, is what it is, I mean, yeah.
I will say that, to be very honest, like when we've been going through like our lists and when the medical providers were, registering with us, and then many times we're calling them, they're like, oh no, we already have our staff, vaccinated by, by this other group, or they were able to get them with the healthcare system. I mean, I get the frustration. I also know the frustration on our end when, we're going through a list of 20 and we have 15 of those individuals say, oh no, we already got it. Granted they can be taken off our list, but I think that is happening, like you said, a lot until we get, it's just getting more vaccines so that then,
Right. And again, he's on all those all those hospitals, but he's also on Oakland County and he's 89. They haven't called him either. So, I mean, it's not like one county it's all about getting the stupid vaccine, period. Okay, thank you.
Thank you, Commissioner Marecki. And speaking of getting the vaccine, if we say, for instance, the state gave us 20,000 vaccines next week, will we be able, and do we have a system to automatically get those out without any going to waste?
Oh, absolutely. Yes. Like I said, what we have right now, but we have other pod locations where we can then activate them to be, you learn from the way you set things up at one location, what works. We definitely have a good flow and, within a short amount of time. I mean, even I will tell you the experience from setting up Schoolcraft College. Then when we went over to Wayne County Community, it was that much easier because we knew what worked at Schoolcraft and we used that same model. So yes, absolutely.
Okay. Great. And then the appointment days and times for scheduling, how far out are the appointments at this point?
Right. Very good question. And yes, like I said, we've got this week finished up and we're already bouncing into next week. So it's not like we're 4 or 5 weeks out. No, we're pretty much about like the next week.
Okay. So Commissioner Marecki's dad,
but that's the thing. We aren't taking for just individuals. We are still working with
right groups. Okay. Yeah. Okay, great. And then for those that have received the vaccine, has there been any cases where someone has gotten COVID after that you know of that received a vaccine?
You know, that's a good question. And I talked to our medical director about that just myself last week, and very rare, but my understanding is I think there have been now cases. So as we're all hearing, we get the vaccine, you know, we get vaccinated. We still need to keep, you know, our diligence up with wearing our masks, social distancing, good personal hygiene, not getting in, you know, large, you know, not being with, you know, large groups of people. We're still at that point where, you know, even vaccinated, you can get COVID, or would you get it, but then not really know and still be able to shed, you know, to others who have not been, you know, vaccinated.
Okay. And any deaths from the vaccine that you know of?
Not that I know of, no.
Okay, great. Well, thank you for that report. It looks like Commissioner Anderson has a question. Go right ahead.
Thank you. I just wondered, Carol, if you could tell us, has any progress been made on getting a system for those that can't log on to a portal to schedule or to try to get their vaccine? Because I know it was mentioned on I believe it was the weekly or bi-weekly call last week that there might be some effort to reach out to someone. I think the mention was Quicken Loans, which I don't know if that would be possible, that has like a telemarketing company, you know, or established business that way. But we've really got to do something for those that don't have access or can't get their name on a list through a portal.
Yes, and we have heard that, and we are exploring multiple options. I can tell you that.
Okay, so it looks like there may be something coming, right?
We know that we certainly realize there is a need within our, you know, the residents that we serve here in Wayne County to offer where, you know, someone can call in and then have an appointment made for them. Yes.
Okay, and was there any updates that you could give us on the hospitals? Because a lot of people are telling me, I tried to go to the portal and I can't, they're not taking anyone right now. And
right. You know, and the last time we had it was okay, today's only Tuesday. Yeah, it was last week. And we mentioned that, and they, you know, none of the hospital systems reported out that, you know, their systems were back down, crashed, or, you know, any problems. But we always make sure we let them know, you know, what are we hearing? So, but yeah, they all are up, you know, accepting, you know, people in their, you know, even individuals who are not necessarily a current client, you know, in their portals. And yeah, to the best of my knowledge, all the healthcare systems are up and running on those portals. Yes.
Okay, because I've been getting reports that some people are having trouble getting in the portal, that being told that they're not accepting or making any appointments right now.
Okay.
But anyway, thank you so much.
Thank you.
Thank you, Madam Chair.
Thank you, Commissioner Anderson. And again, thank you, Ms. Austin Berry, for your report. Just one last question about the communication issue of getting out the correct information, timely, updated. What do you think will become of that?
Right. My first is I need to touch base with our Director of Communications, Bill Nowling, as Commissioner Clean, and we need to get our plan. You know, I honestly don't know exactly where he's at with his planning and ours. I don't know, Commissioner Clean, if you realize Mike McElrath, actually Friday was his last day. So I know that he got a job at, I can't remember where he went. So I think communications possibly is going through a bit of a, you know, personnel transition here. And touch base, you know, I know you knew Mike, you know, touch base back with Bill Nowling and, you know, where are they at, what have they, because I know Mike did a lot of fact sheets and all, you know, those last couple weeks before he left.
Yeah. Okay.
Okay. Well, thank you. Thank you again for all that you're doing. And we just want to stay abreast and let our folks know what's going on and make sure that it's the best information that, we have. So,
Yep.
thank you so much.
Thanks.
You have a good rest of your day. Next item, Madam Clerk.
E, such other matters as may be properly submitted before the committee.
There are no other matters. Next item, public comments. Are there any public comments out there? Oh, I'm sorry. Commissioner Anderson, did you have another question? I see your hand raised. Nope, okay. Any public comments again?
We do have one emailed comment.
Okay, can you read that for us?
It's from President Buffington. It says, "My condolences for attorney and radio personality Cliff Woodward and Abina Hogan."
Yes, we did have two great community activists that passed away. And my condolences as well to their family. Thank you for that, that message. Any other public comments? And I see none. So we'll move to the next item.
Adjournment.
Is there a motion?
Support.
It's been moved and supported. And I will see you guys next week. Thank you.
Bye.
Thank you, Madam Chair. Yep.